Hello, everyone. So, Nigerian government begs over 600 newly inducted foreign trained doctors not to travel overseas. Okay, these are even foreign trained, not even the Nigerian trained ones. Instead, the government urged them to prioritize patient care, uphold ethical standards, and contribute to improving Nigerians' healthcare sector. The Nigerian government, Sahara Reporter says, has appealed to over 600 newly inducted foreign trained medical and dental practitioners to resist the growing trend of migrating abroad for better working conditions, popularly referred to as Japa syndrome. Okay, I understand the fact that the sentiments beside it, but beyond words, what has the Nigerian government done to ensure that the people stay? This newly inducted, you know, foreign doctors, foreign trained doctors actually stay back in Nigeria? Have you provided good governance for them? Are their lives protected? The salary that they're going to be getting, is it a living wage or just merely surviving wage? If they are kidnapped, what have you done with the colleagues that they have heard being kidnapped? A lot of doctors are being kidnapped by terrorists, and I remember having a conversation with doctors, and I was like, I don't really understand, why are they kidnapping doctors, and it's almost like almost the way they kidnap Catholic, priests and stuff like that. Why are the terrorists, bandits, and all of that kidnapping doctors? And she said something to me that was quite revealing that I've never thought about and never heard about. She said they use them to treat themselves and also to treat their captives. And I was like, whoa. So it made sense to me then, because you hear it all, because I kept wondering, what's this, what's with doctors that they keep abducting them. Remember when Kaduna train abduction happened? I think they were in captivity for months, and there was this woman that was pregnant, and that she needed CS. She was going to have a difficult birth. They had scheduled her for CS and stuff like that, and she was in that captivity, and she gave birth there and everything. So apparently, and then they were saying that they had medical, doctors who could do the work, who did a lot of things there. So that made sense. So if you look at it now, most of the time when these doctors are abducted, the Nigerian government just keeps quiet. It never says anything. It just continues with its business. And then now you're telling, newly inducted doctors that they should stay behind. What are you going to do for them? How are you going to protect their lives and properties? How are you going to make life easy for them? How are you going to give them good governance, accountability, and transparency? Are they going to have good rules that they're going to travel to their different places, hospital? Are their lives going to be in danger? How are you protecting them when patients die, and then the families of those patients harass them, come after them? What have you done, to protect them? How are you going to help them with equipment so that they are able to save patients that they ordinarily would save with the right kind of equipment, instead of waiting and just watching that patient die and traumatizing them, knowing fully well that that patient could have been saved if there was a proper equipment, proper um, amenities or resources available. What are the things? These are some of the things that the Nigerian government should be asking itself and answering the question. It's not just to emotionally blackmail people and say that, oh, don't travel, don't do this, don't do that. But anyway, let me go back, to the article. Instead, the government urged them to prioritize patient care, uphold ethical standards, and contribute to improving Nigeria's healthcare sector. What ethical standards have the leaders in the Nigerian government set for the newly inducted governors for them to also follow? The plea was made during the induction ceremony of 622 foreign trained doctors and dentists organized by the Medical and Dental Council of Nigeria, MDCN, in Abuja on Thursday. Among the inductees, 606 were medical doctors, while 16 were dentists, with over 70% of the candidates passing their qualifying examination. Professor Ali Patti, the coordinating minister of Health and Social Welfare, underscored the critical role of healthcare professionals in national development. He encouraged the new doctors to remain dedicated to their calling, emphasizing the need for their expertise in revitalizing the country's struggling healthcare system. The profession you're stepping into is central to our nation's development, he said. Your skills are needed here to save lives and ensure better health outcomes for all Nigerians. The Minister of Health, represented by the ministry's permanent secretary, Daju Kacholom, has called on newly inducted medical practitioners to approach their profession with compassion, integrity, and a deep sense of responsibility. I get it, you want the people to have all of this, the doctors to provide all of this, but you also have to give them an enabling environment for them to be able to do this. You cannot have people who are abusing the system and you expect compassion from them. You cannot have people who don't have compassion from their leaders to be able to give compassion. And so it's one thing to say all of these things. It's another thing to really sit down and put things together that will make people give these things, that you will not need to even be making these remarks, really, because if you have enabling working environment, I tell you, people will want to come to work in your country. It's not just people that are citizens of that country, but people from other countries also. The government and the health sector are working towards delivering quality and safe care. For years, citizens have raised concerns about the state of our healthcare system. With over 600 new doctors joining the profession today, your role is critical in addressing these challenges. The minister emphasized the immense trust society places in healthcare professionals, urging the inductees to take their responsibilities seriously. As doctors and dentists, you must demonstrate empathy, resilience, and adaptability in an ever-evolving field, whether innovating technologies or addressing the needs of a diverse population. Your works directly impact lives, he added. Acknowledging the trends of professionals seeking opportunities abroad, the minister urged the graduates to remain in Nigeria and contribute to the development of the health sector. Let us build a better image for our healthcare system and our nation. Please don't japa. Stay and help make a difference, he appealed. Professor Folabi Lesi, MDCN chairman, echoed this sentiment, stating the government's effort to improve conditions of health professionals. He encouraged inductees to participate in national health initiatives and community outreach programs address healthcare disparities. The federal government is committed to enhancing healthcare delivery. Your collaboration with other professionals, policymakers, and administrators is essential in fostering a more efficient system. Together, we can transform healthcare in Nigeria, Lesi added. Well, they went on and on. Lesi also commended the graduates and their families for their dedication, reiterating the MDCN support for their professional development. Fatima Kiari, MDCN registrar, underscored the importance of professionalism and adherence to ethics. She reminded the new practitioners of the council's mechanism for accountability and the need to uphold high standards in their practice. Your diverse training experiences are a valuable asset to Nigeria's healthcare system. Use them to enrich the sector and ensure access to quality care, equitable access to quality care, Kiari said. Make the nation safe, make it a place where people can grow, where meritocracy is given its place in society, where there is no injustice the way we have it now. Make it a place where you have opportunity, you can grow. No, you can't be stifled. Nobody is telling you that you are from this area or you are not from that area. When you do that, you won't need to beg anybody. They will all come over. Thank you so much for watching. Bye.